Today, we're talking about estradiol acetate ring, vaginal. It's a hormone used by women to reduce symptoms of menopause, like hot flashes and vaginal dryness. These symptoms occur when the body produces less estrogen. If you're using this medication for symptoms only in and around the vagina, you should consider other products like cream or vaginal tablets before using this product. The recommended daily dosage and the best time to take this medication will depend on your individual needs and should be determined by your healthcare provider. Before you start using estradiol acetate ring, vaginal, make sure to read the patient information leaflet from your pharmacist. Wash and dry your hands before handling the ring, and be sure to insert it high into the vagina as directed. The ring is usually left in place for 3 months, then removed and replaced with a new ring if treatment is to be continued. Do not leave a ring in place for longer than 3 months. The dosage is based on your medical condition and response to treatment. If the ring is put in properly, you should not be able to feel it and it will not interfere with sexual intercourse. If the ring falls out, rinse it with lukewarm water and put it back into the vagina. If you have trouble removing the ring, contact your doctor. And remember, tell your doctor if your condition does not improve or if it worsens. If you experience nausea, vomiting, bloating, breast tenderness, headache, or weight changes, make sure to inform your doctor or pharmacist. It's important to remember that the benefits of this medication outweigh the risk of side effects. However, you should still contact your doctor if you experience any serious side effects such as nausea/vomiting that doesn't stop, mental/mood changes, unusual vaginal bleeding, severe stomach/abdominal pain, or any symptoms of toxic shock syndrome. In rare cases, this medication may cause serious problems from blood clots, so seek medical help if you experience symptoms such as chest pain, sudden/severe headache, or trouble breathing. If you notice any symptoms of a serious allergic reaction, seek medical help right away. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. When using estradiol acetate ring, vaginal, it is important to be aware of the potential risks and benefits. Estrogens, whether used alone or with another hormone, can rarely cause serious side effects. It's important to discuss the risks and benefits with your doctor before starting hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Estrogens can increase the risk of cancer of the uterus, but taking a progestin as directed by your doctor can help decrease this risk. Be sure to tell your doctor right away if you experience any unusual vaginal bleeding. In postmenopausal women, estrogens, taken with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used along with a progestin, estrogens can also increase the risk of heart disease, such as heart attacks. The risk for serious side effects may depend on the dose of estrogen and the length of time it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Be sure to discuss the use of this medication with your doctor and check with him, her regularly to see if you still need to take it. If you will be taking this medication long-term, you should have regular complete physical exams as directed by your doctor. If you are allergic to estradiol or have any other allergies, talk to your doctor or pharmacist before using this product. Before using this medication, tell your doctor or pharmacist your medical history, especially if you have a history of certain cancers, blood clots, heart disease, liver disease, kidney disease, high blood pressure, diabetes, or other medical conditions. Do not smoke or use tobacco while using this medication, as it can increase your risk of certain health issues. If you are going to have surgery or will be confined to a chair or bed for a long time, talk to your doctor about any special precautions you may need to take. This medication can cause skin darkening, so limit your time in the sun and use sunscreen. If you develop vision problems or a vaginal infection while using this medication, contact your doctor. It should not be used during pregnancy or while breastfeeding. It's important to be aware of potential drug interactions when using estradiol acetate ring, vaginal. This means that it could change how other medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aromatase inhibitors, such as anastrozole, exemestane, letrozole, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, possibly causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If you or someone else has swallowed the estradiol acetate ring, it can be harmful. If you think there has been an overdose and you notice serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, reach out to a poison control center right away. You can call your local poison control center at 1-800-222-1222 if you are in the US, or a provincial poison control center if you are in Canada. Symptoms of overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. As for the daily dosage, the estradiol acetate ring is typically inserted into the vagina and left in place for 3 months. It is important to follow the instructions given by your healthcare provider. It is best to insert the ring at the same time each day to maintain consistent hormone levels. Be sure to remove the old ring before inserting a new one. The benefits of using the estradiol acetate ring include relieving symptoms of menopause such as vaginal dryness, itching, and burning. It can also help prevent osteoporosis in postmenopausal women. It's important not to share this medication with others. While using this medication, it's important to have regular complete physical exams that include lab and/or medical tests, such as blood pressure, breast exam/mammogram, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes that can help to control or prevent these diseases include reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking. It's also important to keep your mind active with mental exercises, such as reading and solving crossword puzzles, to help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you're experiencing hot flashes, lifestyle changes that may help reduce them include stopping smoking, dressing lightly or in layers, avoiding/limiting certain foods, spicy foods, caffeine, alcohol, reducing stress, and exercising regularly. If you haven't inserted a new ring after 3 months, be sure to talk to your doctor or pharmacist about getting a new dosing schedule. It's important to store the estradiol acetate ring at room temperature and keep it in the pouch until you're ready to use it. Make sure to store all medications in a safe place away from children and pets. When it comes to disposing of the ring, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.